You see the setting of the parameters. I'm happy that there is Angelo Crippa as a huge expert in the field. You see that is a, let's say, slow cooking of the vein, so it's not a lot of energy, because indeed the aim of the technique is to reduce the caliber of the vessel, not to occlude it, so that then you can inject a mild sclerosant, that is dextrose 75%. So now you could just stand up and go away, because you know that in Italy there is no dextrose 75%, so we are not talking about something that here can really be developed. We might have 50%, and we can agree or not on the fact that maybe 50% work as much as 75%. You can see the benefit they report in this approach in terms of a mild sclerosant, because indeed the toxicity is basically null. You have far less pigmentation. At the same time, you need some technical expertise, because dextrose 75% is clearly a sugar. So you have a more dense fluid to inject, and the injection technique is a little bit different, because you are injecting while retracting the needle under augmented reality. We did a study also looking at the possible combination of polydocanol and dextrose together, showcasing no significant difference, but I kindly disagree with myself, meaning that I was involved in this publication, in the scientific writing, but the way they mix the two things together was not really standardized. So we never went to the lab to see, is it always the same fluid we are injecting, because the mixture of the two things could be a little bit heterogeneous. So we have preliminary data that suggests there might be no significant difference. It's fundamental to use the augmented reality if you want to do CLACS. And even with the term augmented, we could discuss it, because the technical term augmented reality should be a 3D projection of something that is not really this as case. But it's a very interesting tool that also forces us to change a little bit the technical approach, because the first time you try it, you tend to look at the needle and the image of the vein. But in reality, you don't have to look at the needle per se. You have to look at the projection of the needle, because you have what is called a parallaxis effect. So if you look at the needle, it's actually projecting a little bit on the left in this case. So I will have to look at the left and just go following the image that is projected, because it's not a transilluminator. It's really a camera like the ones of the army that is collecting the image and reprojecting the image. So it's interesting. It's not providing any hemodynamic data, but it is very cool to see how many feeder veins we have of those capillaries that we usually don't see, and we don't see them with a transillumination. CLACS lovers use a specific score that is called a score 1-9 or 9-1. Basically, you have on the horizontal line the telangiectasia. As you can see, no telangiectasia, with a feeder vein that is deeper or not. And at the same time, you have in the vertical the reflux that can be present just on the tributaries or also on the saphenous trunk. You see the green and the red light. When you have the green on the right, you will have